I always emphasize validation because, of course, for everything we do, we need to validate to see it's clear or not, if it's valid or not, but also based on my experience trying to validate some results and getting a no validation result. So when we use the single cell technology, we have to use a lot of computing methods to get to our results. So it means that we take data that has multiple dimensions and we flatten them in a way that we can understand. So in the process, we use a lot of filters or we make a lot of decisions that are subjective, meaning we can incur error in the results. So once we have the results, we cannot simply celebrate and say, okay, this is what is the most vulnerable neuron, for instance. We need to use another method to make sure that it pans out. So in our case, we use a method that's very powerful. We take tissue, postmortem tissue of several individuals, and then we use antibodies. We run immunohistochemistry in which we can label, for instance, this protein produced by the gene that seems to be a marker of vulnerable neurons, markers for neurons, marker for excitatory neurons, and then we just count everything. So in our case, using this method, it's more time consuming because we cannot automate and we need training. We could show, for instance, that RORB really pan out. You can test it in whatever dimension or direction you want. The results will always be the same. But with other markers we detected, with the bioinformatics, we could not validate. So probably they are results of bias or errors that we introduced along the way and we could not see.